Well, without doubt, the greatest achievements we've had over the last 5 to 10 years has been the introduction of workloads processes and then moving on to ratios delivered through nursing hours per patient day in a large proportion of our public health system. The achievements we've made have set a very good baseline from where we'll need to continue to campaign, but we've got a lot of work to go.
There are many challenges for us in all our sectors, and the answer, I believe, is to mobilise the power that we have in those workplaces. I think the challenges in the public sector for nurses and midwives is still, the main one is still workloads. In the private hospital sector, I think the challenge there is to get them to actually understand the benefit of being part of the collective.
Making sure that wages keep pace. Our members are saying that workloads is a real issue in private hospitals. In aged care, it's an ongoing battle about trying to engage with employers around enterprise bargaining, about trying to continue to push up wages there.
The majority of our members in aged care are assistants in nursing, and they are part of the nursing family. They're a very important part of the nursing family. And we have to make sure that they have the confidence to stand together and enforce their rights. Similarly, in the disability sector, we actually, those members have been engaged for a long time, and they are clearly under the pump with the privatisation agenda.
There are so many campaigns, there are so many issues, so many fronts that we have to be involved in, that we actually need to determine what are the goals that we're looking at, what is it the key directions that we need to follow, and the strategies that we put in place need to be well focused. We've had discussions around the staff about developing the key directions, the vision and the goals that we need to achieve in the next 5 years. Every day there's another distraction put in place by employers or governments into what we've really got to try and achieve. We face enormous challenge in terms of Conservative governments who are attacking the bedrock of our public health system. They're trying to change our society to one that has less of a focus on looking after those that can't help themselves and more of a focus on the individual and the power of the individual versus looking after the whole of our society.
Nursing and midwifery are always the biggest budget items, and so it's always a quick fix to trim those, or at least keep them at the levels they've been at for the last few years. But ultimately that means that our members have to do more with less.
We have to be forever striving for a better Australia. We can't have a situation where we are heading backwards.
The power to make change has to happen when you stand together.
So we've got to make sure that there's a universal health system in which our members work, which can deliver for the people, to make sure that our members are in a better workplace, they're in a better financial position, and that they live in a society that is about the greater good, not about the greater profit.
To make sure that nurses and midwives are able to deliver care safely, we've got to get ourselves more organised inside the workplaces so that when all those workplaces come together, we've got the power to make the decision makers, i.e. the current Baird government, actually take notice of what we're saying. They need to be able to find those workplace leaders that are on all their units and encourage them to be part of the collective at an active level.
Some of the most important ways of influencing what is happening in our community is to step out of just workplace organising and to step into community organising, to engage in social discussion about